Hello and welcome. Today we'll be discussing a common condition affecting men as they age, benign prostatic hyperplasia or BPH. This involves an enlargement of the prostate gland, which, while not cancerous, can lead to a number of bothersome urinary symptoms. Let's delve into the details of BPH, exploring its causes, effects, and management. The exact cause of BPH isn't fully understood, but several factors are believed to play a role. Age is a primary risk factor, as the likelihood of developing BPH increases significantly with advancing years. Hormonal changes, particularly those involving dihydrotestosterone, or DHT, seem to be implicated. DHT is a hormone derived from testosterone, and an increase in its production can stimulate prostate growth. Genetic factors may also contribute, meaning that if you have a family history of BPH, your chances of developing it are somewhat higher. Finally, lifestyle factors such as obesity and lack of exercise might also influence the development of BPH. In BPH, the prostate gland undergoes hyperplasia, meaning there's an increase in the number of cells. This enlargement of the prostate causes it to compress the urethra, the tube that carries urine from the bladder. This compression narrows the urethral opening, making it more difficult for urine to flow freely. As a result, the bladder has to work harder to push urine through the constricted urethra. Over time, this increased effort can lead to bladder wall thickening and weakening, further contributing to urinary symptoms. The combined effect of urethral obstruction and bladder dysfunction results in the characteristic symptoms associated with BPH. BPH is an extremely common condition, affecting a significant proportion of men as they age. It is estimated that BPH affects approximately 5% of men between the ages of 51 and 60, and this percentage increases to as high as 80% by the age of 80. While some degree of prostatic enlargement is almost inevitable with age, not all men with an enlarged prostate will experience bothersome symptoms that require treatment. The prevalence of symptomatic BPH varies depending on the study and the definition used, but it's a significant healthcare concern due to its impact on quality of life. The symptoms of BPH can vary in severity and can significantly impact a man's daily life. Common symptoms include frequent urination, especially at night, which is called nocturia. There may be urgency, a sudden and compelling need to urinate, even if the bladder isn't full. Hesitancy, or difficulty starting urination, is another frequent complaint. There might be a weak urine stream, a dribbling stream, or a feeling that the bladder is not completely empty after urination. In more severe cases, BPH can lead to urinary retention, which is the inability to pass urine, a serious condition requiring immediate medical attention. Diagnosis of BPH typically involves a combination of assessments. A thorough medical history and physical examination, including a digital rectal exam or DRE, are performed to assess the size and consistency of the prostate, or urine test or urinalysis is done to rule out infection or other conditions. A prostate-specific antigen, or PSA, blood test may be ordered to screen for prostate cancer, although elevated PSA levels can also be caused by BPH. Uroflowmetry measures the speed and volume of urine flow to assess the degree of urethral obstruction. Post-void residual measurement determines the amount of urine remaining in the bladder after urination. In some cases, cystoscopy, which involves inserting a small camera into the urethra to visualize the prostate and bladder, may be performed. While BPH doesn't have distinct types, in the same way that some diseases do, it is often classified based on the severity of symptoms, prostate size, and the degree of urinary obstruction. Some men may have mild BPH with minimal symptoms, while others experience moderate to severe symptoms that significantly impact their quality of life. The classification helps guide treatment decisions, with more aggressive treatments typically reserved for those with more severe symptoms or complications. Treatment for BPH depends on the severity of symptoms and the impact on quality of life. Options range from lifestyle modifications to medications to surgical interventions. Lifestyle modifications include limiting fluid intake before bedtime, avoiding caffeine and alcohol, and practicing double voiding. Medications include alpha blockers, which relax the muscles in the prostate and bladder neck to improve urine flow, and 5-alpha reductase inhibitors, which shrink the prostate gland over time by blocking the conversion of testosterone to DHT. Surgical options include transurethral resection of the prostate, or TURP, a procedure to remove excess prostate tissue, transurethral incision of the prostate, or TU, which widens the urethra by making small cuts in the prostate, and laser therapies, which use lasers to destroy or remove prostate tissue. More recent advancements include minimally invasive procedures like prostatic urethral lift, Urolift, and resin water vapor therapy, which offer less invasive alternatives with faster recovery times. The best treatment option is determined in consultation with a urologist, considering individual factors and preferences. Currently, there's no definitive way to prevent BPH. However, certain lifestyle choices may help reduce the risk or slow its progression. Maintaining a healthy weight, engaging in regular exercise, and following a balanced diet may be beneficial. Some studies suggest that certain dietary supplements, like saw palmetto, may help with symptoms, but the evidence is inconclusive and should be discussed with a healthcare professional. Early detection and regular checkups with a doctor are essential for managing BPH and preventing complications. The prognosis for BPH is generally good, especially with timely diagnosis and appropriate management. While BPH itself is not life-threatening, the associated symptoms can significantly impact quality of life. Most men with BPH can effectively manage their symptoms with lifestyle modifications, medications, or minimally invasive procedures. Recent research focuses on developing new and less invasive treatment options, as well as identifying biomarkers that can predict the progression of BPH. Studies are also exploring the role of inflammation and the microbiome in the development and progression of BPH, potentially leading to new preventive and therapeutic strategies in the future. With ongoing research and advancements in treatment, men with BPH can expect to maintain a good quality of life,